Coming up to 7:15, accident and emergency departments across the UK are seeing record levels of young children for this time of year, with most suffering a mild fever which can be treated at home.
The surge has been caused by viruses which would normally flourish in the winter, but the spread was delayed this year because the lockdown meant children were not mixing as much as normal. Our health reporter, Philippa Roxby, has more.
Record numbers of young children are being seen at accident and emergency departments across the UK. Doctors say most have a mild fever, which can be treated at home. They say they're overwhelmed.
I was on a couple of Mondays ago. We saw nearly 300 patients in a day. We're seeing lots of young children, less than 1 year old, with fevers, a bit of vomiting, maybe a bit of diarrhea, who generally look quite well, but there's parental anxiety about those symptoms, and we simply don't have enough staff to keep up with that demand.
A&E doctors across the UK have told the Royal College of Paediatricians and Child Health they've seen large increases in children attending, particularly those under 5. In some places, demand is double normal levels. One doctor in Belfast said she was extremely worried about what would happen if numbers continued to rise. In Liverpool, there are reports of pressure on inpatient beds, and a doctor in Edinburgh spoke of lots of children with viral illnesses that don't need hospital treatment. Children going to A&E are not unwell with COVID, but with other infections normally seen in winter.
Children have been in lockdown since the early part of last year, and particularly younger children, their immune systems just haven't been challenged in any kind of way by the kind of normal viruses that we always have around us all the time. And now that lockdown's been eased, they're now being exposed to what are just the usual viruses, and of course now they're becoming unwell.
14-month-old Theo was seriously unwell. 2 weeks ago, he ended up in A&E.
I was really frightened, very scared, especially because he had all the spots all over his body. You always think the worst, and with a high temperature, as high as it was, we were thinking that it was something seriously wrong.
A&E is the correct place to take a child in an emergency, but there are times when parents should trust their instincts.
Fever phobia is so common, and it's everywhere in the community, where people get worried about the fever rather than their child. And what I try and tell people is, if you're just worried about the symptom, like if you think your child's fine, but it's just the fever you're worried about, or just the diarrhea, or just the vomiting, actually your child's likely to be okay, because you know your child best, and if they're well, they probably will be well.
Susie did the right thing. She gave Theo liquid paracetamol to try to bring his temperature down, then called 111 for advice when he didn't improve. Doctors say A&E services should be freed up to help seriously ill children like him.